Hello, I'm Laura Kusumoto, and I'm honored to be speaking with you today about applications of immersive technologies in healthcare. Today, we're at a turning point in our industry. After decades of development, XR in healthcare is no longer experimental, but it's also not yet routine. We're in the process of moving from innovation to implementation. By immersive technologies, what I mean is extended reality, which is usually presented to users through a VR or virtual reality or AR or augmented reality headset. But I also embrace the use of computer monitors, mobile phones, and smart glasses to deliver some of the 3D content, although they can be less immersive. The healthcare system part of this is related to delivering medicine or healthcare or learning how to deliver them. I also include the empowerment of patients and consumers to take better care of themselves. So even if you're not working in healthcare, I think some of the challenges that I'm talking about here will be familiar to you. To introduce myself, I'm the founder of IterationZero, working with startups, healthcare organizations, and technology providers. I help organizations evaluate, implement, and scale emerging technologies in healthcare. My perspective is based on a technical background, industry experience, and working across many different ecosystems. My work sits at the intersection of innovation and real-world deployment, helping organizations move from promising pilots to implemented systems that actually operate at scale. Today, I want to talk about a few different things. I'll start with grounding on where healthcares are under pressure today and give some examples of where solutions are needed. Secondly, I'll look at the immersive technology field and where there are examples of things that we know actually work and that are effective in healthcare. From that, we'll look at where major companies and systems are moving from this innovation stage into integration into their systems at scale. And then we'll look at what are the factors that enable the adoption for something that's a really successful technology to then move into a system and be used more broadly. And finally, we'll look at some of the interesting future directions that we're seeing. Let's start with some of the challenges that healthcare industry has. We want to be sure that any solutions that we offer provide benefit to the patients, but also help to solve some of the pain points that healthcare systems have. And there are a few. Here are some of the systemic challenges that broadly impact many healthcare systems. Starting on the right, there is rising demand for healthcare, and this is partly because of an aging population. Statistically, people over 65 use a disproportionate number of healthcare resources, from hospitals to prescriptions and nursing home care. And along with that, the incidence of chronic conditions, blood pressure, cholesterol, diabetes, and so on, and mental health needs are on the rise. Then add to that, there's an urban-rural divide in many healthcare systems where the rural people may not have access to all of the specialized care that they need. So that's a common problem. Moving over into engagement and prevention gaps, this really has to do with engaging patients in their own care, helping them to understand to take their own medication, understanding what the instructions are, providing education about how their health works, and also leading to behavior change to healthier behaviors. Also, there are clinician shortages. That's part of a long-term trend that was accelerated by COVID-19, where there are not enough doctors, nurses, therapists, and so on. And there have been, some of them are retiring. There are too few clinicians in the pipeline to become new doctors and nurses, and so on. And last but not least, there are inefficiencies in the system. Any large system does have some administrative load. There are long wait times for certain kinds of care and some care delivery bottlenecks that need to be resolved. None of these are failures of medical knowledge today. They're challenges to delivery, scale, and engagement. I'll now turn to looking at the immersive technology that works. For each category, I will identify which of these 5 challenges are addressed by the solution that is proposed. Immersive technology in healthcare has been in the works for 40 years. In that time, over 10,000 papers have been published on XR in healthcare. Over 2,000 applications exist in VR or XR for healthcare. And there have been over 500 startup companies devoted to this intersection of XR in healthcare. So let's take a look at just a few of these. I've picked 4 classes of applications out of many. For each one, I'll give you an illustration. I'm not endorsing these specific solutions. I'm just using them as examples of these areas where we know these immersive interventions work. A major use case in the first example is pain management. It's a significant class of immersive applications that started their development back in the 1980s. In medicine, this is an area where we really do need to improve outcomes because the current tools of medicine are not able to take care of everyone. The example here is ApplyVR's Relieve VRX, which is a clinically validated VR treatment for chronic pain that provides education and distraction, with studies showing meaningful and durable reductions in pain. This is a really good example of something that clearly works, but it still needs to fit into the healthcare system for more people to have access to it. A second huge category is that of mental health. Immersive technologies have shown to be effective in a number of these areas of mental health, including PTSD, post-traumatic stress disorder, addiction, anxiety, depression, and more. Here I'm showing 2 examples, a clinical one and a consumer-facing one. The hallmark of successful commercial apps is they often have multiple ways to access them, through the VR headset, but also through a mobile app. And in this case, the Trip app offers an AI coaching assistant as well. So there's multiple modes of interacting with it. And I do think that in mental health, this is an area ripe for even more opportunities because there are many more needs out there and more medical approaches needed. A third broad class of successful applications is rehabilitative and physical therapy. The problem is that in physical therapy, for example, that many physical therapy patients don't finish their programs. It's inconvenient, it's boring, and it's painful. And as many as 50% quit before they've completed their prescription. The example shown here, Emergo Labs, allows the therapist and the patient to appear as avatars co-located in a virtual world. It also allows for gamification and other ways to entice the patient to complete their treatment, allowing office visits both at home and in the office to keep their practice consistent. There are many therapy and rehab solutions out there, but they also need to be fitted into the healthcare systems in order to become widely accessible. A fourth really broad class I'll mention is medical training and simulation. The benefits of training with simulation in the medical disciplines industry are very, very clear. It's faster and it's better. It accelerates learning and it increases retention of what was learned. We're seeing increased adoption of the current generation of high fidelity specialized programs across the industry now. So we've seen there are immersive technologies that are working in many areas. So why aren't they everywhere? The challenge is no longer whether XR works, it's whether it fits into our healthcare system. Let's take a look at some of the solutions. And at the beginning, the migration from this idea of point solutions where every vendor and every application really focuses on one problem to how do you take all these great tools and bring them into an integrated system with integrated solutions. The healthcare systems do require more system level fit, and that's where the industry is working right now. Let's take a look at a few of the healthcare systems that are starting to adopt at scale and offer these solutions to many thousands of people. A leading example, one of our biggest examples, is the United States Veterans Health Administration. This is the largest integrated healthcare system in the United States. There are 371,000 health professionals and staff that serve over 9.1 million enrolled veterans through a network of 170 medical centers and over 1,100 outpatient sites of care. Since 2016, thousands of VA clinicians have been enabled to use dozens of applications for their veteran patients. They now have some offering of VR in every state and territory of the United States. Next up, we have a list of all of the active use cases that VHA is using. You'll see that there are many clinical applications, as well as some in employee education and operations. So obviously they're very numerous, but they're not the only ones. So as another different kind of example, XR Health is sort of a virtual health system that has arisen around immersive technologies, and it is reaching out directly to consumers to offer them their services, which is VR, various kinds of VR therapy. As you can see in this slide, they're actually advertising on Facebook, at least in the United States, to attract consumers directly. So, and this is now available in multiple countries. Overall, across the United States, at least, a number of major healthcare systems and universities, we're seeing widespread adoption, not just in pilots, but in education, therapy, and operations. So what actually drives and enables adoption when we go beyond the point solutions and have a more integrated view of what we want to offer to the patients? We have to start with the understanding that in healthcare, a solution doesn't scale just because it works. It scales because it fits into the system. And that is a good portion of the work to make things, to implement things. On the institutional level, of course, there are the regulations that need to be followed. In Europe, it's MDR and the CE mark that's required for selling solutions and devices in Europe. There's also reimbursement models. The people who have developed these solutions somehow need to be paid, and that goes through reimbursement models. Public health governance, the government agencies in each country and region also are need to be shown that these are effective treatments that they want to support. Moreover, GDPR, data privacy, needs to be taken care of, not only in Europe, but in every country. We must protect the data of not only patients, but also employees. On the organizational front, clinical workflows have to incorporate the use of these devices if they are hardware devices, and that requires some work to get that totally integrated. Procurement processes are important too. It's one thing to buy a pilot program for a few people to use. It's another thing to have it made available to hundreds or thousands of people, obviously. And last but not least, in organizational, the IT systems and integration are absolutely critical for any of these technologies to work on a regular basis. People are very, very important. If clinicians don't adopt and don't believe in these interventions, they will not use them. So that is a very important part of this. And overall staff need to be trained to manage the devices, the applications, to use them to the benefit of the patients in the process. And change management is an overall methodology for making sure that everybody who needs access to this and needs to use it knows how to do it. So in summary, the success factors here are that the solution needs to fit into existing workflows. It has to reduce and not increase the burden to clinicians. It has to have clear, measurable outcomes that the system and the public governance understands. It needs to align with the system's priorities, and it needs to have support of leadership. In 2024, with the International VR with Healthcare Association, we asked 15 organizations who had significant experience with large-scale VR implementation in healthcare. We asked them what were their biggest challenges in scaling up and adopting the use of immersive technology in their own organizations. And these four issues rose to the top of their concerns. Interestingly enough, the top one was interoperability and standards. They want to be able to take one application and run it on many different devices. They want to have similar user interfaces across these different devices as well, but also training the human resources to be able to use the technology. Enterprise IT is a super important part of this, and managing the devices. If there's hardware to be managed, just like mobile phones and laptops and other sort of clinical devices, headsets, if they're brought in, need to be managed as well. One of the questions that I get a lot is, how can I possibly build a long-term solution given how unstable the XR industry seems to be? It seems that every other month we hear another announcement of some division of a company folding or some part of a platform being discontinued. And I show some examples of this on the left. And then on the right, we also hear really promising announcements about new operating systems coming out, new hardware, even for medical hardware in particular. And then, of course, dozens and dozens of new wearables in the form of smart glasses are coming out. So how are you supposed to build for the long term? And the answer lies around, first of all, focusing on the use case and delivering value with that, but also incorporating open standards wherever possible. And I've also found that people that are already in the process of adoption, they find ways to continue using the things they've acquired in general, because even when announcement of the platform changing is made, it doesn't happen right away. So they still have 1, 2, 3 years of room to make adjustments. Back to that subject of interoperability and standards, the Veterans Health Administration also invested in documenting what they call the Made for Healthcare Immersive Guidelines from 2023 to 2025. This document still exists, and I am one of the folks who's working on trying to make it publicly available as an open standard. Also, it's worth considering that mobile device management companies also have, such as Arbor XR and Manage XR, and then the platform management systems that they have at the major platforms. All of these also have the vision of being able to incorporate many different solutions into the same device or the same operating system. So keep an eye on those as well. All right, that's where we are, industry in transition in a very positive direction. What are some of the emerging technologies that are going to influence where we go from here? One of them is that we're finding more and more AI in everything, including in XR. It's having a profound effect on what XR can do for people. And combine that with the idea of smart glasses and other wearables, we can envision a not so distant future in which people are wearing their computers and able to use AI delivered directly to their head or wherever it's needed. And this also provides a continuous feedback and interaction with the world and with information systems. Digging into smart glasses, in particular, I recently did a talk for this at the IVRHA conference, really focusing on that if you want to learn more about it. But there are clinical use cases that have already been documented for smart glasses. There are training use cases. And then there are opportunities to help individuals live their better, healthier lives outside of the healthcare system as well. I think it's really interesting to see how AI is augmenting the already effective XR solutions that are out there. Training is a particularly great example because AI can help add depth to simulated patients. It can add more variations of scenarios in training. And some of that may be making it specialized, gastroenterology and ophthalmology and so forth. So giving very specialized variations of scenarios. It can give coaching. It can even assess students as they're going through their training. Procedural augmentation, meaning in the operating room, there can be practice for a specific patient, a specific procedure. There can be procedure planning, and of course, patient education around what it is that they're going to experience. Clinical assessments are a growing area of combining these sensor-rich XR systems with AI. And a great example is ophthalmology. There are several new pieces of equipment for assessing ophthalmology using VR. Another really interesting example that was unveiled a couple of years ago is created by Cedars-Sinai. It's called XAIA, Zaya. It is a behavioral health agent, but it's been implemented in 3 dimensionals, represented as a robot, and it effectively is a kind of personal counselor that people can talk to. This is available online, by the way. If you have an Apple Vision Pro, you can download it and use it, or upload it and use it. Notice how it creates a different environment around you, and it can change that to help your mood. But more importantly, there is a very rigorous knowledge base behind this, developed by psychologists and psychiatrists, that can provide a helpful conversation with people. And so this is very, very controversial, but I do recommend, if you're concerned about it, looking at the website Zaya.health and looking into the rigor with which this has been created. But more interestingly, at the VMed conference here in Los Angeles last month, Cedars-Sinai also unveiled that they're taking this agent and creating a mobile version of it that helps doctors in their workflow. For example, when a patient comes in, the office always takes some kind of intake interview about their symptoms and related factors. Well, now they are trying out using this AI to do that interview with the patient, also providing other kinds of support for the clinicians. So I think this is this combination of AI and XR. Some are more XR oriented, some are more AI oriented, is a really, really important area to watch and to develop. And last but not least, I want to leave with this idea of empowering the patient and consumer to be stronger agents of their own health. It is their lives and their journey that we want to be successful, right? So VR and AR offer the more ability to offer over-the-counter, clinically validated interventions that the patient can take home and use in conjunction with their consultation with their clinicians. Also, we've already seen the example of how XR can help humanize AI by providing a pleasant interface, a more natural interface, and visual explanations for the patient. Furthermore, assistive technology is growing very fast in the smart glasses, for example, for low vision, for low hearing, and that will help enhance patients' lives to be healthy outside of the healthcare system. So we're going to conclude with the future is bright. Immersive technology is entering a new phase. And the winners are going to be those people that are able to align these interventions and these new capabilities into the existing healthcare systems, who can integrate with existing systems and workflows and help to scale this to make it accessible to everyone who needs it. So I think the future of healthcare will not be defined by what it can do in immersive, but by where it will actually become part of everyday care. It's been a pleasure to talk to you today. I welcome your contact and questions. Please join with me on LinkedIn. Feel free to make an appointment to talk and follow up on these topics. I love to talk about them. So thanks again for listening to me today. Bye-bye.